Hello, I'm John Pope. I'm one of the TechTank Team. I just want to introduce myself real quick and let you know I am not a professional presenter, but I can promise you this will be shorter and more interesting than almost any medical lecture you've ever sat through. So thanks for listening, and I hope you'll find this interesting. TechTank mobile app COVID-19 came about very quickly from a project we were working on. We were trying to do real-time clinical data almost instantaneously for prevention and mitigation efforts. And COVID came along. So we decided, hey, we've got something we can use for this. So here's how it works. This is under the Take the Heart initiative, and we operate as a nonprofit organization. I am going to briefly show you how to use it, but we do have a how to website, and the link is below. Of course, if you're watching this, we can definitely hand it to you. Very quickly, once you get to the link, it'll lead you to where you can download the app itself. Right now, we have it out on iOS, so your iPhones, iPads, and so on work very well. We are waiting. It should come out on Android anytime now. It's possible, but by the time you're watching this, it may be out on Android already. What you see below is a screenshot of my phone, actually. I'd already downloaded it, but this is the app itself and what it looks like when you download it. Once you get it downloaded and open the app, the TechTank app comes up, and on the left you see a screenshot. It shows enter code. We have different surveys in here, but we have a couple that we presented for COVID. One is for the user themselves or the consumer at home, and one is what we're calling the pro version. The pro version gets a little more detailed and gives us a little more information. Also, it makes it so you can make it facility specific if you like. Once you enter the code, and by the way, let me add, there is a chance that our next update it'll just be a button to push, but right now you have to enter the code. Once you enter the code, you get to this next screen. This is actually a screenshot from the Pro version, and it asks for a patient ID code. This has been a little bit of something we've had to explain. The patient ID code can be anything you want it to be. If you have a specific facility, you can call the patient C1, C2, C3, whatever you want. You make it up. If it's a church and you just want all of them say the same thing just so they know it's a church member, they could just put the name of the church. Or you could, whatever. I made an example on the next slide over. I was actually eating breakfast and drinking coffee, so it was Biscuit 1 BR549. Just so you know, you can do that. NPI number, that was a request and it is optional. So if you want to use it, you can. If not, you do not have to fill it in, and then you hit next. Once you do that, it'll take you into the survey. Once you're in the survey, once again, the pro version, what you see here on the left is a blue screen. That's what the questions look like. You simply click, and as soon as you click, it swipes to the next question. None of the surveys are long. I've tested it several times, and the survey takes less than 30 seconds, even for a person that first reads it. Once you get to the end, you have the options to submit it, to start over, or go to the home page. Of course, if you make a mistake, you can start over. Or if you submit it, you will still have the option to take again if you were assisting a family member or you had a group of people in front of you, so on and so forth. Just to make note, the app and the survey are free to the user. They can download it for free, take it for free, and they can help anybody else take it for free. So, what's so great? There's survey screens out already. They're on the internet, they're on the TV. What makes us different? Well, if a home user takes the survey, they enter their zip code into the app and request it. So, at one point right there, you do have at least the area that they live in. But the other part is because it's an app, because your phone has geo tracking in it, we can actually tell you almost to the address, almost to where they're standing, where the person takes the survey. This means that either version, the consumer version or the pro version, we can tell you almost to the point to where they're standing. This comes in important much later. Now, the home user gets the benefit of the screen, and we gather the information of where they are and what they're talking about, but not specific to the person, so we're not crossing PHI and information guidelines. This gives us a chance to locate hotspots because we can narrow down to where they're standing when they take it. It also date and time stamps it so we know when. We can look at an area and see if everybody had the same symptoms at the same time or if everybody had different symptoms. We can see when. And then, of course, are they all in one area or are they scattered all over the place? Because it's an app, And because you can download it and because it's free, you can do it anywhere and anytime and any place, anywhere in the world. So how the pro version is a little different. Because you can make any ID specific to your organization, facility, or company, when we run the data out of it from the repository, we can actually pull exactly your data. That way you can see if you want to separate it and just say, hey, this is just my company or just my hospital, so on and so forth, we can do that. The other thing is if an individual knows the ID that you put them in under, if they come back, say, for future follow-up testing, because we still don't know what's going to be immune, what's not, or if they need to be tested again, we can actually compare that. Few examples. If a church is operating online and they can tell all their members over the whole thing, say, hey, take this, put in FB Church 1, and they can see their whole congregation and see who's sick. They could see who's not sick. They could see a worry area. And of course, we've seen outbreaks in groups, so that might even let us narrow that down. If a hospital tells all the providers to fill it out over the patients they see, you can locate what you're seeing in the hospital, as well as, because it's done by zip code as well as geolocation, where they're coming from. What about an ambulance service or a fire department or a police force? They're seeing people all over the place, so you could actually gather data from them everywhere. If a prison screens its inmates, or if a nursing home screens its residents, the possibilities are endless. Kind of give you a visual. What happens immediately when they take it, it goes to a data repository. We gather every survey taken. Now, what you see here is a screenshot of the regular consumer version. The part that you really can't see is where it geolocates. That's further on in this spreadsheet. But we gather every answer, and because it comes out in Excel, of course, you can sort, pull out graphs, dates, times, so on and so forth. To give you a little better view, this is one from a example from our pro version, and you can see we've got addresses if they put their MPI number in, latitude and longitude, so we can actually abstract that. Now, if you look at the patient ID column, which is column B, they put whatever they want to in there. But if QQ happened to be a company, then we could pull out everything that QQ said. What that means, and please excuse me, these are just for visual. What you see on the left here is a world map of cholera, and then on the right is a United States map of HIV hotspots. The point being is we could do the same thing for COVID-19 all the way down to state, city, local areas, and you would be able to pull it in almost real time. What we can do for facilities and organizations, you can source the tracking by zip code like we mentioned earlier. If you identify the patients to the point you desire, or if you just want to identify the group, however you want to do it, or if you don't want to identify them at all and just contribute to the data gather. Facility resources, you can see where they're being taxed at. You can see your waves and surges, when they happened, where they happened from, so on and so forth. A lot of larger facilities and larger companies may have some of this data capability and metric capability, but a concern is a lot of the smaller facilities may not. This gives them the ability to do things that some of the bigger guys can when they really need it because their resources are taxed as well as everything else that's out there. The data comes out in an Excel format. It's easily extractable. We can merge it with other things because of Excel's capabilities. And of course, if you're familiar at all with Excel, you can also pull out graphs, whether you like your pie diagrams or any other kind of bar fixture, whatever you'd like. So this is how we impact at a local level all the way up to a global level. We can actually change the world. You could actually save lives with this. We have a data warehouse. We'll gather all of it. We can share it. CDC, DPH, WHO, universities, anybody else like that. We can use it for comparison to what they gather, assistance to what they gather, things that they don't have because we can get it out there. We can use it in our research processes, our planning processes, mitigation of this whole incident as it stands. And honestly, if we can get it out fast enough, we could even use it in response. We could try to stem the expansion of it, help lower the curve as much as the world's trying to do. Not only for this one, but the next one. This has been unprecedented, but of course, the influenza in the early 1900s, before they had an app for that, and now we are. Why not use what we can? part of our idea was to be able to take the technology we have and use it to benefit us. We can get real-time, immediate data and shareable without crossing ethics and personal information. So help us help others and help you. We've got an app for it. All we have to do is use it. Thank you from all of us. Tech.